The Sussex Integrated Care Strategy is really our 5-year plan to improve the health and care services for the 1.7 million people living in Sussex. And I say our plan quite deliberately because this has been done collectively, not only with the individual parts of the NHS, but also with our 3 local authorities, the 2 county councils in West Sussex and East Sussex. The City Council in Brighton and Hove have also been very much involved in this, alongside our universities, voluntary organisations, community organisations and a Health Watch, in addition to over 3,000 members of the public who've contributed to the development of this plan. So this really is our plan to improve the health and care services in Sussex. Well, what we want to do with the Integrated Care Strategy is to enable people to live healthier, longer, more fulfilling lives. And I think that's a really important starting point, is what does the population need? And one of the things they also need is actually access to our services when they need it, where they need it, and how they need it. And so therefore making a more personalised service is exactly what we need to try to do. The health and care system is experiencing incredible challenges at the moment, and that's just a fact of life. And part of that is down to the fact that people are living longer and have more demand for the services that we provide. We've got a cost of living crisis. There's a number of other conditions, and it's not just flu and COVID at this time of year, but even in the summer we've got an influx of visitors and even heat-related issues. So there's always a demand for our services, and sometimes we haven't got the capacity to meet those as quickly as we would ideally want. So I think one of the things we need to do is to think about how we can help people stay healthy for longer. And that, I think, is the real trick to some of this. In addition to that, we also need to be thinking around how we actually manage our services better to make better use of the money that we have. It's also quite clear that we've got a large workforce. We've got over 35,000 people work for the NHS in Sussex, but we still have vacancies. And so it's really important that we can recruit more people into the health and care service to provide more care for people. Well, I'd argue there are 3 main areas of focus for this particular plan. And the first is to create joined up, integrated community teams. So really for the first time we want to bring all of our health and care services together and wrap them around a local community rather than wrapping them around a particular organisation. So that's the first and key component. I think another particular focus is going to be how we grow and support and develop our workforce. Because without our workforce, the NHS and social care really is nothing. And then we need to make best use of digital technology and information sharing. Well, our integrated care strategy has got to look at all parts of our population. And I think that's one of the reasons why we're thinking about how can people start their lives well, live their lives well, and age well. Now, when it comes to children and young people, I think we need to do more in this area, because there's no doubt that kids have been really affected by the COVID pandemic. And I think particularly in the area of mental health, we need to think about how we can wrap more services around children and young people, whether they be at school, in education, or just starting out at work. So I think all of those components, we need to think about that as a community in their own right to help them fulfil their potential in the future. Well, there are many ways that this integrated care strategy can be measured in terms of success. And the first and most important is what our population tell us. So I think if we can deliver more joined up care where people can get the care that they need when they need it, and then they can tell us that that's the case, that will be a sign of real success as far as I'm concerned. The other thing that I'm keen to do is to ensure that we can reduce some of the inherent inequalities that already exist within our Sussex system. So in different parts of Sussex, there is a 14-year difference in life expectancy according to where you live. And I think that's unacceptable. So we not only need to improve the level of service across the piece, we need to reduce the level of inequalities in terms of access, in terms of experience, in terms of outcomes. The strategic vision, which is what the integrated care strategy is, has laid out what we want to achieve. But I think what we now need to do is to work on a shared delivery plan across all the different parts of the system. And so that's all the different parts of the NHS. It's our local authority partners, universities, also Health Watch, and also our voluntary and community organisations, as well as the public, to help to define who is going to do what and by when. Because to turn this 5-year vision into a reality, we've got to have a really deliberate plan for each year over the next 5 years to be able to genuinely deliver our strategy, which is all about improving lives together.